Well, you are most welcome to this video. Now, one of the things we like to do on this channel is improve awareness of disease to help relatives recognize disease in other people, so that we can recognize disease to some extent in ourselves, but we can recognize disease in other people. Then we can seek the professional help that is required. And the disease I'm talking about today is dementia. Now, dementia is a progressive, irreversible impairment of intellectual function. And it's very important to know about. And let me give you some reasons why it's important to know about. One of the things is we can optimize health. So we can make sure people get enough brain fats, the omega-3 fats, enough vitamin B, enough vitamin D. And we also need to know if people have insulin resistance, because if people have got insulin resistance, the sugar in the blood won't be getting into the brain adequately, and there's things we can do about that. But it's also important because there's some specific, not reversible treatments that can be given, because dementia is irreversible, but there's very good symptom management strategies that can be put into place that can really help an individual. But maybe most importantly of all, people with dementia are a danger to themselves and others if it's not recognised. Now, if the dementia is recognised, we put strategies in place and we can mitigate virtually all of the risks, because we don't want people with dementia going out, getting lost, getting confused, causing problems in public places, falling over unnecessarily. And they're also a danger to themselves and others. So obviously they're a danger to themselves, but they're also a danger to others potentially. Suppose someone with dementia, for example, was, suppose they were in charge of a bus. Then they were driving the bus, but because they're not able to cognitively process properly, and because they can forget things and become confused, then they're a potential danger to those that are in the bus. So the people in the bus are potentially at risk if the driver of that bus has dementia. And also, of course, the bus driver themselves is at risk. They're a risk to themselves and others. And people outside of the bus, for example, walking on the sidewalk or the path, or people crossing the road, could also be at risk because the bus driver is suffering from dementia. So lots of reasons to know about it, to help the individual and to help those around the individual. We're not going to be able to reverse it because by definition it's irreversible, but so many management strategies can slow it down, optimize health and improve quality of life of the individual. And it's important, I think, to note that dementia is not part of the aging process. Dementia is a disease process. So many people reach great age and don't suffer from dementia. So it's important to recognise this so that we can get the treatment strategies in place, keeping the individual safe, keeping others safe. Not part of the aging process. We don't say, that's just old, whatever his name is or her name is. They're just getting old. No. Dementia is a specific disease process. It just happens to affect the brain and central nervous system. Other diseases affect the heart, other diseases affect the kidneys, other diseases affect the liver. There is no shame in this, it's just part of the disease processes. It just so happens that dementia typically is more common as people age. Not always. There is pre-senile dementia. My brother, for example, developed dementia in his early 50s, quite tragic, called a frontotemporal dementia. And even younger people than that can develop dementia as well. If it's associated with older age, it's often called senile dementia, but it's not part of the aging process. Now, a lot of people know about Alzheimer's disease, but I want to bring your attention today to a specific type of dementia. And the particular type of dementia I want to bring your attention to is often associated with movement impairment. For example, Parkinson's type features where an individual can have shakes and tremors, but also where an individual can lose facial expression. They can look zombie-like and not quite with it. So you can get the dementia and these movement difficulties together. They're more prone to weaknesses and they're more prone to falls. And often with Parkinson's disease as well, the person can be going along quite normally, or not quite normally, but they can be going along, and then all of a sudden they just kind of freeze up like that, as if there's sort of a well, literally they can become frozen for a period of time. So let's look at this form of dementia. It's not Alzheimer's disease, which is the most common. It's actually the second most common degenerative dementia. And I want to use an American site, which is really very, very useful here. This is this one here, Lewy Bodies Dementia Association, LBDA, in the United States. So Lewy bodies, 1.4 million people in America suffering from it, men and women. And it's the presence of Lewy bodies. This is how this is defined. So Lewy bodies are small abnormal proteins found in the brains of people with Lewy bodies disease. And they're tiny. They're inside the cells. They're in the cytoplasm, in the cytosol of the cell. So Lewy bodies disease is associated with the presence of these Lewy bodies. Now, these can only actually be diagnosed with a brain biopsy, which we don't normally do. It's a pretty invasive procedure, or as post-mortem. It's usually a post-mortem diagnosis. But there are these characteristic features. And I actually started working with people with dementia when I was 18. When I was a student psychiatric nurse, the first ward I was assigned to for 3 months was in those days we called it a psychogeriatric ward in those days. So elderly people with dementia-related problems. So you come to recognise the particular types, and very often this is a recognition clinical diagnosis. And those of us that have worked with these people on and off for a lifetime, this is well over 45 years ago. Yeah, probably is. You come to recognise these things. So let's talk about this one specifically, but very interesting. Presence of Lewy bodies typically progresses rapidly. Very often Lewy bodies, dementia and Parkinson type feature patients, because the two go together in Lewy bodies very often, they do go down very quickly. So, 1 year you might meet them and they seem okay, then a couple of years later they've got really quite severe movement difficulties and the cognitive impairments associated with that are dementia. Can be quite progressive. Lewy bodies Dementia Association say this: we understand that though many families are affected by this disease, few individuals and medical professionals are aware of the symptoms, diagnostic criteria, or even that Lewy bodies exists. So it's important to have a high index of suspicion for Lewy bodies when we get the dementia with these Parkinson type features, the frozen features, the frozen episodes, the falls. Important to consider this. Now, hopefully most people this is considered, but often it's not, and we certainly see cases where Lewy body is missed until a late stage, and that's a pity, because the treatments of the symptoms in Lewy bodies are different from Alzheimer's disease. These patients respond differently, so it's important to be able to differentiate between the two conditions. Lewy bodies dementias are the second most common form of degenerative dementia. Alzheimer's is the most common. Now, Lewy bodies has three common presentations. Some start with a movement disorder leading to a diagnosis of Parkinson's disease and later develop dementia. So the movement difficulties, the freezing, the falling, the sometimes shaking and tremulous tremors that they can get, the mask-like expression, sometimes that starts first. They always tend to develop all of the features, but sometimes others develop quicker than others. So some start with movement disorder leading to diagnosis of Parkinson's disease, which of course is common. So Parkinson's disease is common, and pretty well all doctors tend to know about it. Well, all doctors do know about it, of course. Everyone knows about Parkinson's disease. And so that's often diagnosed first, but Parkinson's disease and later develop dementia. And that's diagnosed as Parkinson's disease with dementias. Others start with a cognitive impairment first, and that can be mistaken for Alzheimer's disease because that's the most common form, or even it can be mistaken for vascular disease. But eventually that will be leading to a diagnosis of dementia with Lewy bodies. But as I say, this is something that is recognised by elderly care doctors, physicians, neurologists, rather than something that has got a specific diagnostic test and anyone who's worked with it for a long period of time. A small group, a third group, will present with neuropsychiatric symptoms. So psychiatric symptoms, which of course can be quite concerning and really add to the danger to themselves and to those around about them that are in their circle of influence. There can be hallucinations. It's funny that the patients I've talked to with this, very often they hallucinate animals and children. They're the two things. So they'll say, what was that little girl doing there the other day? Or have you got a new dog? You know, they often see these things. It's and to them they're real because they are confused as well. My dad didn't actually have Lewy bodies as far as I'm aware, but he did have dementia, and he was wondering why there was a snake in the house. Didn't frighten him particularly, but he said, what was that snake doing in the house? I don't think there was a snake in the house. But again, if we recognise these things, we can reassure the sufferer and be with them. We can come alongside them and help them, which of course is what healthcare is all about, really, isn't it? So hallucinations, behavioural problems, difficulty with complex mental activity. So the behaviour will change, and they have difficulty with complex mental activity. So it would be very difficult, for example, for someone to maintain a job as a solicitor or a lawyer of some sort, or a senior engineer or a doctor. So someone who has to use cognitive processing, it would become basically impossible for them to function in a normal way. Most common symptoms of Lewy body disease include impaired thinking, such as loss of executive function, that's the higher planning, processing information, memory, or the ability to understand visual information. So they might be confused as to what part of the visual picture in their visual landscape in any particular time is important. And they might sort of focus on something that's not really the main issue while ignoring something that is the main issue. Very typical of Lewy body's dementia. Difficulty understanding visual information. Fluctuations in cognition, attention, or alertness. Now, this means that it can vary. So some days they might seem, or sometimes they might seem not too bad. You think, the lady or gentleman's not too bad, but other times they can be really quite affected by the condition. Fluctuations in cognition, attention, and alertness. Problems with movement, including tremor, stiffness, slowness, and difficulty walking. So this is typical in Lewy bodies. Difficulty movement, including tremors, stiffness, mass-like expression, as we've said, slowness. The whole person kind of slows down, and all the movements become painfully slow. So they go to undo the shirt buttons, and it's really, really slow. And then they do it up, and it's really slow. And you want to say, oh, come on, let me do that, because they're just so slow. Everything kind of slows down. It's called psychomotor retardation. Another very typical feature. Visual hallucinations, as we mentioned. Symptoms are treatable, and it's important to differentiate between Lewy bodies and other dementias, as we've said, because the response to treatments varies. Early and accurate diagnosis of Lewy bodies is essential. Early and accurate diagnosis is important because Lewy bodies patients may react to certain medications differently from Alzheimer's disease or other patients or Parkinson's disease patients. So again, they need to be diagnosed by specialist physicians, neurologists, general practitioners, physicians, people with doctors with a special interest in this, nurse practitioners, whatever it is, with a special interest in this, who can give them the right treatment and not just say, oh, it's dementia, treat it as dementia, or it's Parkinson's disease, treat it as Parkinson's disease. No, these treatments can be bad for these individuals' symptoms with Lewy bodies. They need specific management and specific understanding from specialist nurses and doctors, which is what we always seek to refer them to. A variety of drugs, including some dementia meds and some anti-Parkinsonian medications, can worsen the features, as we've said. So it's important to know which condition we are actually treating. Lewy bodies disease affects an individual's brain differently than others' dementias. Treatment should always be monitored by a physician and may include prescription and other therapies, exercise, diet, sleep habits, changes in behaviour and daily routines. So the routine that someone was in may no longer be the optimum appropriate routine, and they may need to change to another routine. Change of employment, for example, might be appropriate, as the case that we mentioned if someone is in charge of a bus, as we mentioned. Individuals and families living with Lewy bodies should not have to face this disease alone. Lewy bodies affects every aspect of a person: their mood, the way they think, and the way they move. So the way that their mood will change, and that can affect their decision making, of course. The way they think, their cognition is changed and reduced, and the way they move is also affected. These things come together in Lewy bodies. The combination of cognitive, motor and behavioural symptoms creates a highly challenging set of demands for continuing care. Physician education is urgently needed so that all doctors know about it, and everyone needs to know about this condition, which is why we're doing this video. We want to improve awareness of Lewy bodies disease. So look at people around you and consider Lewy bodies as a possibility, then seek the appropriate help, because remember that they are potentially a danger to themselves and to others. More research is urgently needed, of course, and research needs to include tools for early diagnosis, such as screening, questionnaires, biomarkers, neuroimaging techniques, and more effective therapies, of course, are always needed. So there we are. Recognise dementia in those around you. Recognise Parkinson's disease, of course, and very often when the features of those two things are combined, consider Lewy bodies. Take the person who is you're worried about to the specialised physician, get a proper diagnosis. And if Lewy bodies is the case, symptom management can improve it. Environmental management can reduce the risk of the patient to themselves and to others. We certainly don't want them in charge of buses, and that can help the situation generally by an honest appraisal and an objective evaluation. So hope you found that interesting, and thank you for watching.